Yeah. Thank you, Chair Sanders. The committee is reauthorizing today multiple expiring public health programs to help doctors, states, and communities better address Americans' health care needs. Our responsibility in this committee is to fully evaluate and improve programs so they work properly for those served and effectively use tax dollars. Congress can continue to fund expired programs, but failure to reauthorize misses an opportunity to improve. If a program doesn't work or meets its full potential, this is our opportunity to help it either get rid of it or help it work to its fullest potential. These have been achieved in a bipartisan manner, and I appreciate my colleagues working to complete this task, and I look forward to future bipartisan markups. Today, the committee examines Senators Young and Kane's Dr. Lorna Breen Health Care Provider Protection Reauthorization Act, reauthorizing a program helping nurses, physicians, other healthcare workers access mental health and substance use services. And of course, this grew out of COVID, where Dr. Breen, so burned out, committed suicide. And this is just an example of the incredible strain and burnout healthcare professionals experience sometimes while providing life-saving care. I'm proud to say I helped lead the original legislation enacted in 2022. This reauthorization ensures continued access to needed care. Senator Budd and Cassidy's Emergency Medical Services for Children's Reauthorization Act of 2024 extends grant programs helping emergency medical services care for children. Obviously, children have different medical needs than adults, and providers must be equipped for these differences. The Poison Control Center's Reauthorization Act of 2024, led by Tuberville, Murray, Romney, and Lujan, reauthorizes the Poison Control Centers program. These programs support enhancement and improvement of poison control hotlines and other poison education and prevention services. For the best acronym of the day, the Building Our Largest Dementia, our BOLD infrastructure for Alzheimer's Reauthorization Act of 2024 extends programs improving education and detection of Alzheimer's and other types of dementia. And this effort and the award for the best acronym goes to Senators Collins, Cortez Masto, Capito, and Kane. Senators Collins and Baldwin's Lifespan Respite Care Reauthorization Act of 2024 reauthorizes the Lifespan Respite Care Program. This helps communities provide a little bit of time off for family caregivers for disabled adults and children or those with complex conditions requiring full-time care, if you will, to allow for that family caregiver to have a little care for their own mental health. Senators Durbin and Young's Congenital Heart Futures Reauthorization Act of 2024 extends programs related to congenital heart disease, research, education, and surveillance, directing the HHS Secretary to convene a workshop to improve care for adults living with congenital heart disease. When children with congenital heart disease grow up, they oftentimes have trouble finding providers specializing in these conditions. We're not only reauthorizing, which is, by the way, the flip side of adults needing different care than the child. We not only are reauthorizing existing programs, but considering new legislation. The East Palestine Health Impact Monitoring Act of 2024, led by Senators Vance and Brown, directs HHS to examine potential health effects of the horrific train derailment in East Palestine, Ohio last year by supporting a longitudinal study within the community. I thank Chair Sanders for today's markup and all my colleagues and their staffs for making this a successful collaboration. Thank you.